To our evening here and want to give a little bit of an introduction to them, as sometimes we have people from our team talking, sometimes we have our wonderful colleagues from other institutions like Columbia tonight talking. So Dr. Johnson is a pediatric gastroenterologist and an assistant professor at Columbia University Medical Center, and she's also part of their Celiac Disease Center, one of the main faculty there at Columbia, and delivering amazing care, amazing comprehensive care to children and adults with celiac, and also very dedicated to research and specifically celiac research and educational program at Columbia. So an area of Dr. Johnson's research and also Dr. Lee's is focused on really looking at the impact of celiac on the social realm of life and quality of life, both in children and adults who have celiac disease. And Dr. Lee is also an assistant professor at Columbia, specifically in hope I have this right, the nutritional medicine department. Okay, wonderful. And also a dietitian in the Celiac Disease Center, and very much involved in comprehensive patient care for children and adults, and also research. And similar, really focusing on that effect of the gluten-free diet on quality of life in these social realms. And it's very exciting. Both Dr. Lee and Dr. Johnson have been involved in lots of research, but recently presented findings and getting published a study that looked at gluten transfer through kissing. And so that will actually be the topic today of their looking at research in general on this topic and also their research at Columbia. And with a wonderful title, we'll start us off tonight: To Kiss or Not, the Gluten Concerns in the Social Realm. So I will pass it to both of you to continue and to start your talk tonight.
Great. Thank you to the organizers for inviting us. I know Anne and I are both really excited to get this data out there. Let me just pull up my slides. I'm going to start with a little bit of background. All right. Can you see the slides?
Good.
Okay, great. Okay, so I thought before we get into the real details of why, of the kissing study itself, we would talk a little bit about why a study like this was even needed in the first place. And so, you know, this is a familiar paradigm for people in the celiac world. After getting diagnosed, they're told that small amounts of exposure can still result in intestinal inflammation and symptoms, counseled on the need for a strict gluten-free diet, making sure there's no cross-contamination. And then as they go on through their celiac lives, they have certain experiences, either social or medical. They take that. They have a story that's been told about where they're going to be contaminated and concerns around that. And then there's all the outside influences of friends and social media, and even the medical team who can, in some cases, drive some of these concerns. And this just leads to a bit of a culture of fear surrounding eating. That often will then move into avoidant behaviors, and then sometimes into hypervigilant behaviors with associated increase in anxiety and decreased quality of life. So this is something that we see every day in the clinic in children and adults. But I think the really interesting question is to go back and say, what is the data that we actually have on cross-contamination? Because for a long time, many of the recommendations were driven by the most cautious that we can be, but without actual scientific evidence behind it. So that's where this story starts. And there's been some really wonderful research over the past several years to take a look at some of these big social activities and risk for cross-contamination in these settings. And so I just put a couple of them in here. This was a study that was done fairly recently by the Celiac Disease Foundation, and they were looking about just like a kitchen setting and whether or not soap and water was good enough. They were looking at whether or not pasta was contaminated if it was in the same water. And I just, I highlighted two rows here because I think that what was very interesting is that there was actually less contamination than people expected. So can you see my pointer? Yeah, the mouse. Yeah, okay. So gluten-free pasta that was cooked in shared water, there was a lot of gluten that got detected in the gluten-free pasta sample. But when you travel down here and you have even like pasta that was cooked in shared water and then rinsed afterwards, actually none of the samples that they looked at had over 20 parts per million. And this is really the column that's set as the threshold for being gluten-free. And in some cases, in 4 of the cases here, the gluten was actually even undetectable, right? So that's not to say that we should go out and, rinse the pasta off, but I think it's showing that giving us some real data on how much gluten is actually transferred in certain circumstances. Another study looked at some common social environments for children, specifically looking at playing with Play-Doh or home ec projects, paper mache. And what they did was they took children and they put them in this environment, and then they took a piece of gluten-free bread and rubbed it all over the kids' hands, and then homogenized the bread and sent it off to test it for gluten. So they looked at, whether or not Play-Doh transferred from the hands, or they actually rubbed some gluten-free bread all over the table that kids had played with the Play-Doh at. And the kind of moral of this story was that wet things like paper mache and the home ec project, which was like rolling out cookie dough on a gluten-containing floured surface, these were high-risk activities for gluten exposure. But for instance, with Play-Doh, the vast majority of kids after playing with Play-Doh with their hands didn't actually have a significant amount. And the one that did test higher here, there was actually visible Play-Doh on the gluten-free bread when they sent it off for testing. So again, not to say that people shouldn't be careful, but starting to put a little bit of data behind what the recommendations are. And then the last study I wanted to share, which is probably one that we get some of the most questions about, is whether or not shared fryers actually result in cross contact. And this particular study looked at 2 different scenarios. It looked at several different restaurant samples of French fries, and on the bottom here. And there were 5 fries, 1 tater tot sample, and 2 chips fried in a shared commercial fryer. The products themselves were gluten free, but the oil was shared with gluten containing products. And interestingly, you can see here that in the commercial samples that they tested, only the tater tots really had detectable gluten. They did another study using a home fryer where they took gluten-free French fries and a gluten-containing, I believe it was chicken nuggets, and they fried the gluten-free chicken nuggets, the gluten-containing chicken nuggets, excuse me, and then they fried some French fries. And they tested that first batch. That's this one, F1. Then they did it again. And as the oil got progressively more dirty with more gluten exposure, they found higher rates of gluten in the gluten-free French fries. And so there definitely seemed to be some cumulative risk associated with the kind of dirtier oil. And there are more ongoing studies looking at what the actual level of risk is here. And again, same bottom line. We still have to be careful. We're not saying go and eat from a shared fryer, but let's start to build the data on what's worth getting, hypervigilant or vigilant about, and what's not worth getting vigilant about or worrying about. And, quality of, go ahead, Anne. I was just going to hand it over to you.
Okay, go ahead.
So I'm going to let Anne take over some of this, because a lot of this is from some research that she's actually done herself. Just to kind of talk about how we know that quality of life, especially in the social domain, is really impacted by celiac and the gluten-free diet.
Right. And because in setting the story, it's so important to see, where people are very concerned. And a lot of the recommendations that have been made, and when we're counseling our patients from the dietitian point of view, we have to really, it has been historical that you avoid, 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 but we're realizing through doing more of our studies on quality of life and the impact of the diet and disease on our patients that we need to rethink how we counsel. And that's why the studies on cross contact are so, so important. So I'm going to kind of walk through the backstory of how we got to our kissing study, and we'll spend a lot of time on that. And as you can see, as Jackie mentioned, that we know quality of life is negatively affected. What we realized 10, 20 years ago is we knew quality of life was affected, but we didn't dive down into all the different domains of quality of life. And as we started looking more and more, we started looking at the deeper nuances of those quality of life studies. And in some of the ones we've done, we've seen that not only are the quality of life scores negatively affected, but we're starting to see other areas deeply affected. Increased social anxiety. An Italian study looked at, found increased rate of depression. A Spanish study found that both the emotion and social domain were statistically significantly negatively affected. And a study by one of our doctoral students, Zhang, looking at gluten-free adaptation of a diet in China, found that the social domain and maintaining a gluten-free diet were very negatively affected. On the next slide, we can see a study by Leffler that was just, again, a great study looking at the overall burden of diet and disease on our patients. And what they found from this study was that the negative impact on our patients with celiac disease was only second to those with end-stage renal disease. So when we're looking at people managing hypertension, cardiovascular disease, IBD, IBS, celiac disease impacts the daily life of these patients more and more. On the next few slides, we're going to go through a couple different studies. Jackie mentioned the hypervigilance study, because as we looked at these burdens, we wanted to say, okay, how does we documented it has an impact, but how does that impact ripple through their lives and different aspects of their life? And so this was a study done with both teens and adults with biopsy-proven celiac disease. We actually did our quality of life survey. We also did a knowledge survey, and we looked at how vigilant they were in adhering to their diet. And we did that through 3 24-hour diet recalls with a multiple pass process. And on the next slide, you can see some of our results, which indicate that, those patients that were rated more vigilant, and that was by rating the kinds of things that they said, like, do you read labels? How often do you read labels? Do you always ask questions? And the more vigilant were those individuals that not only read every label every time, but asked questions at every restaurant, would bring food to the restaurant rather than risk chancing eating, something that might be cross-contaminated, or would only eat in dedicated restaurants, compared to the person that would dine out but call ahead or just ask questions. Okay, so that's how we rank the different vigilance. Those that were extremely vigilant had a major 10-point drop in the overall quality of life score. And interesting, that excessive vigilance was also associated with higher knowledge and feelings of limitation and an increased feeling of burden. When we compare the adults to the teens, we found that both were negatively affected, but the teens in particular, dining out was a major problem because they felt it was frustrating. They felt very socially isolated, and undue attention was given to them. And they felt that that having to frequently ask questions became so burdensome, they would even choose not to eat. And when we compare the adults and the teens, almost 3/4 of teens reported that negative impact compared to just over 50% of adults. And on the next slide, we can see that from there, we looked at that from the hypervigilance study and said, okay, this is concerning that there's so much of a burden and it affects eating out, affects eating with friends. Let's look at, does this now impact disordered eating or different, eating behaviors that may be affected? And with some of our work done with colleagues in the UK, we actually started looking at eating disorders in celiac disease and found that females with celiac disease were 46% more likely to develop an eating disorder. And one of the things that seems to prompt this is that once individuals go on a gluten-free diet, their body starts to heal, and we often see a weight gain. And that weight gain is often the triggering event that sends our patients into more vigilant and more maladaptive eating behaviors. The other thing that Dr. Sadley from the UK did note is that in her patients with eating disorders, many of them also in the diagnosis of an eating disorder at the same time got diagnosed with celiac disease. So we wonder if there's not a bidirectional event going on. So with this premise of looking at eating behaviors and possibly maladaptive eating behaviors, on the next slide, we have some of the results from the study. And we found that not only did the gluten-free diet have a negative impact on overall quality of life, but we found that as people embarked on the gluten-free diet, they would often tend to limit more and more and more foods. So those individuals that eliminated other foods without a diagnosis or need to, like they weren't lactose intolerant, they weren't allergic to anything, but they started to just whittle down the foods that they were allowed, that those people had a much lower quality of life score than those that only eliminated gluten. We also found in looking at this, those that thought about eating more frequently or thought about their weight more frequently also had lower quality of life scores. On the next slide, we see the overall effects that the quality of life score and the amount of depressive symptoms, the presence of depression symptoms, and how they're related. And we found that avoiding more foods was associated with not only more depression, more anxiety, and lower quality of life. On the next slide, we see that I'm so glad she's here to give you hugs. That's so fabulous. That we looked at that and said, how does this impact the social aspect of life? And so we did a study using the social anxiety questionnaire on a group of just adults. And we found, again, interesting little pieces of information that slowly these all kind of put together. Those in the age group of 23 to 35 had lower quality of life and more social anxiety than any other age group. And we also found that those that were on the diet in that midsection between 1 year and 4 years also were most negatively impacted. Those that were diagnosed less than 1 year, we figure there's a honeymoon period where they're kind of, learning about things, figuring things out. And then what a lot of our patients will report in that next kind of 1 to 5 years is that now the reality of, okay, I've got to ask these questions for the rest of my life. I can't eat everywhere for the rest of my life. Things are more difficult. People don't understand. They're not getting the things I'm trying to tell them. And so we see this increased social anxiety with a concurrent decreased quality of life score. And so, those that were single had the highest social anxiety score and the lowest quality of life score. And interestingly, those that the longer on the diet had improved quality of life and lower social anxiety. Okay, and on the next slide, we kind of start going into looking at more of these little nuances. And females were more affected than males, but also we found that specifically in the subdomains of the social anxiety questionnaire, where we look at what specifically are the things about that social anxiety that are triggering these negative responses. One was speaking in public and to authority. So if you think about, well, where does that happen? Anytime you go out to eat, you're in a public place and you're having to make your request for your gluten-free diet to someone that is in a perceived position of authority. And then also the other domain that was significantly affected is that domain of dealing with criticism and embarrassment. And when we think back to that teen study, that's exactly what they were saying, that having to ask the questions was embarrassing. So that as we kind of, each study leads us to another study, and we see these are the things that we need to then kind of incorporate into our nutrition counseling to help role play or to help people learn how to maneuver through these. On the next slide, we actually have some of our overall results is that we can see that these factors affect our patients' everyday life. And it made us then question, well, if speaking, if criticism, embarrassment, speaking in public affects you, how does that affect our social life? So this prompted our dating study with my colleague Jessica Lebowitz, and we in kind of reflecting back, we looked at how much that social behavior. Oops, back the other way. That's okay. We saw how much having celiac disease affected partner interactions. And we can see that in our patients, many people asked their partner to be gluten-free. Some people said symptoms affected, intimacy, but the big one was how many people felt that kissing was something that was a real concern. And so on our next slide, we can see this is what prompted our kissing study. So was our DDW presentation. On the next slide, we actually get into some of the nuts and bolts. We organized the kitchen study because we wanted to make sure, like the cross-contact studies, that we set it up in such a way that there'd be no area of question in terms of protocol. And so the study was set up where we had 10 couple participants. They came in 2 separate visits. The first visit, we had them be the partner without celiac, ate 10 gluten crackers, 10 saltine crackers, 4 times. They kissed the partner with celiac disease only once. We'll go into some more of the graphics in a moment. And on the second one, we had them repeat eating the saltine crackers, but then before we tested saliva, drinking 4 ounces of water. We used we sent the samples off to Biodiagnostics up in Vermont that does a lot of the testing of gluten-free food for gluten-free labeling. And we also had the participants do the gluten detect urine test the night after the kiss and the next morning. So on the next slide, we have kind of a graphic of our different protocol, where on the first visit, the participant without celiac disease had to eat 10 saltine crackers, and that was measured. So we had a measurable amount of gluten, a good gluten load that would be picked up by the gluten detect urine kit. We then had them wait 5 minutes and kiss the partner with celiac disease, and we collected the saliva from the partner with celiac disease. We then had the non-celiac partner brush her teeth, rinse her mouth, eat 10 more crackers, wait 5 minutes. We collected their saliva. We had brush your teeth, rinse their mouth, eat 10 more crackers. And yes, these poor people probably never want to eat saltines again in their life. We had them wait 15 minutes and then followed that with them doing it, waiting 30 minutes. On the second visit, we had them come in. The non-celiac partner ate those same 10 crackers, but then drank 4 ounces of water and then kissed the partner with celiac disease. And then we had them repeat that so we could collect their saliva. Our reasoning was we wanted to look at the saliva of the person that was kissed that had celiac disease, but to compare it to the saliva of the person eating all of those crackers. So on the next slide, we can see our results is that the partner with celiac disease, the amount of gluten that was in their saliva ranged from under 5 parts per million to 153.9 parts per million. Only 2 of the 20 exposures were above the 20 parts per million. Drinking 4 ounces of water reduced all of the gluten in the saliva of the participant with celiac disease to under 20 parts per million. Out of all of the celiac participants, only 1 had a positive urine test the evening after the kiss, and no one reported any symptoms on the gastro symptom score tool. The non-celiac partner, and this is an important thing to look at, is that the amount of gluten in their saliva ranged from 19 parts per million to over 2,000 parts per million. On the next slide, we actually can look at the different concentrations. And what we found is that, in the partner without celiac disease, you can see the vast, this is the partner without celiac disease. These are the range of amount of gluten in their saliva. And you can see that, it really didn't matter whether they waited 5 minutes, 15 minutes, 30 minutes. It did make a difference in most of them drinking the 4 ounces of water. And this is the person that ate the crackers. Why we did these different protocols is we tried to mimic a date night. You might reach over and kiss your date right after taking a bite or something. You may wait till you get back to the car or back home. So we wanted to look at all the various scenarios. The next slide shows the amount of gluten in the person with celiacs and how much gluten was in their saliva. And as you can see, there was only 2 that were above 20 parts per million. All of them were under the 20 parts per million once they drank the 4 ounces of water. And just kind of, when we think of those 2 samples that were above, Jackie and I have laughed about this, but we looked at gender, we looked at length of time since diagnosis, we looked at age, we looked at all kinds of things to try to figure out why were these 2 couples different. The one that had the highest amount of gluten in their saliva had gotten engaged the night before. So they were a little on the more loving side, I guess. It was one of those that, in the protocol, they had them kiss in in a separate spot. But we had to knock on the door several times to tell them that we were ready to come in and collect saliva before they went on. But the important thing on the next slide is to see that the results are that there is gluten detected in saliva, okay? There is some transfer, but the amount is below what you would find in a serving of a gluten-free product. So I used those toothbrushes to cross out the worry about it, because many of our patients came in and said, I make my husband take a shower. Jackie will talk about this in a minute. But what we have found, by science, by research, is that it's really limited amount of exposure through kissing. If you're concerned, have the partner that doesn't have celiac disease drink some water. So really, there is good news. Let's be sensible and let's let common sense prevail. Jackie, back to you.
So just wanted to conclude with one additional slide here, because the question then comes up. So how do we get back to the science and regain control of the narrative? Because the internet is full of a lot of different influencers and people who aren't necessarily using science to guide their recommendations. And so there's also a lot of fear mongering through the internet. So when this study was presented at DDW, it was then posted on a prominent social media gluten influencers Facebook page and Instagram, and there were hundreds of comments. I just filtered through and pulled out a couple of them that really stood out to me, including this. My husband will not kiss me if he has had gluten. Our home has 0 gluten to avoid cross-contamination. I've had my throat swelling up from kissing with gluten in the past. No, thank you. A kiss is not worth being gluten. This misinformation continues to make people not understand celiac as well, and that's why we always get questioned. Are they not accounting for its probability still in the teeth? So to be fair, most of these people didn't get to see the actual abstract. They read kind of some summary reports, but someone else said, my husband had a donut at work at 6 a.m. He gives me a passionate kiss when he gets home at 5:30, and I'm sick for 3 days. This is not really consistent with the science of celiac and gluten exposure. And then I got sick hugging my husband after he had a hamburger. So this wasn't even a kiss comment. And then someone actually said, can we sue them? So I think the bottom line here, though, is that each patient really needs to consider what is right for them. We do know there are different sensitivities, and we do know that quality of life can be impacted. And some people may have more anxiety over taking the risks. So I think it's really important that patients, meet with their dietitians and their doctors, consider what's right for them. However, hopefully more research into this domain can help us balance the scales so that patients can live healthy lives, but also happy lives based on the science that's out there. And I think with that, we can go
we can say thank you so much for having us and letting us share our study, right?
Thank you guys so much. That was such a wonderful and super informative talk. We really appreciate you sharing all your research today.